ladies. Welcome to Plus Size Curvy and Pregnant. Listen, ladies, I am so excited tonight. I have Miss Koreen Baker with Hope Fertility Support and Wellness Center with me tonight. So, you may be asking, like, what in the world we're going to be talking about tonight? And I want to let you know it is a very special, very different type of talk. And it still has to do with fertility treatment options. And I am going to let her talk about herself because I can't even do justice as to what this woman does for women's health, what she does for fertility and treatment in our community. So welcome, Koreen. Hi.
Thank you. Thank you for having me.
Oh, I love having you. Thank you for being with us tonight. So excited. So like I said before, tell us about yourself. Tell us about your staff. Tell us about everything.
All right, so a little bit about me. I am the founder and also the fertility coach of Hope Fertility Support and Wellness Center in Winter Park. And so what we do is we help individuals and couples to conceive naturally. And if you are on the fertility journey in another way through IVF, we help support you through that process as well. And it's all holistic. So a little bit about me. I have a master's degree in social work, and been doing that now for about 18 years. And so my background in social work has really prompted me to make that change when it comes to fertility and treatment options, because I myself have lived this journey. I have walked the fertility journey, been on that roller coaster ride, and I went through 2 rounds of IVF myself, and was able to actually, get eggs and freeze them for future use. So I've been on that journey, and going through that journey, I realized that there was very little supports in place and very little education as to what alternative options existed. So coupled with my background in social work and working in counseling, and I wanted to be able to utilize that as well as add in all the alternative options, such as acupuncture, nutrition, massage therapy, fertility coaching, and just kind of bring all of that together and be able to give patients another experience, another option to fertility. And so with my staff, I have everyone is trained in reproductive health, which is very unique because there are several other acupuncturists that are out there, or nutritionists or whatever, but you really want someone that understands reproductive health, because fertility is a very unique area. And so you really need people that actually specialize and understand that in order to help assist. And so all of my staff, from Dr. Veronica Tynes, who oversees the acupuncture portion, she's the one that does all of our evaluations, assessing patients to determine what kind of treatment modality they're going to need, which is on a holistic level, what type of herbal plan. She does that. We also have massage therapist, Adriana Flores, and she does a lot of your fertility abdominal massages, and also a lot of massage therapy techniques for those who may be going through the IVF journey and your doctor says you need to reduce stress levels. We tailor and customize certain massage therapy to do that, as well as increase blood circulation to the uterus. We also have my other staff members have a functional integrative nutritionist, Marissa Ciorciarelli, and she functional integrative nutrition is completely different than just a regular nutritionist, because their focus is really on food as being your medicine. And so they really work together hand in hand in customizing food that will be tailored to your specific fertility plan, and also what fertility challenges you have. So that's very important. And then, like I said, myself, I do fertility coaching. So I'm that support piece. I'm there with you. I'm that person that when you go to the doctor and you hear bad news, I'm that person that you can call when you have no one else to really turn to, because a lot of people don't understand fertility. And so you are left with very little supports who can really understand your journey. I'm that person, and I'll go with you to appointments. I'll help you find low-cost medications, and I'm that person who will just listen and support you on the journey. And so, and I also work closely with Dr. Tamika Harris-Jackson, and will refer patients to her also for the mental health counseling portion. So I have quite a team behind me. So that really is there to help to support patients on their journey.
Now, listen, ladies, this is a team of people who is like your cheerleaders. They're the coach, they're telling you how to make the hoops, the touchdowns, all that sport analogy stuff. Because I have yet to go to a facility or to join a group or anything like that that was so well rounded and so well versed in alternative medicine. I mean, she just listed acupuncture. I've never actually experienced that, and I'm envious. I'm like wishing that, hey, in the beginning of my journey through fertility, I'm like, I wish I knew of you, Koreen. I wish I knew of your practice and your team, because just to know that there's like, I can come, you're like my BFF on the phone, my thank you for being a friend, golden girl, when you go to the doctor's office and the news is not what you expected, or even when you get that negative pregnancy test, or even have gone through that miscarriage or anything like that. I felt like when I heard of Koreen and her practice, I'm like, wait a minute, I have never heard of that, and I want to know more. Now, ladies, I know y'all want to know more, because if you're as nosy as me, and I love to learn new things, it's time to dig in. So what does a holistic fertility specialist and their team do? I know you just listed everybody's roles. What do they do, and how can it help women like us on this fertility journey? Give us some more. I like juice. I like meat. Give me all the information, because I want these ladies to be, knocking on that door and saying, hey, I need to be on your appointment list, and I need a team behind me as I go through this fertility journey.
Well, a fertility specialist, and like I say, all of my team are, trained in reproductive health, which is so important. But when you have a team of fertility specialists behind you, the ultimate goal is to identify the root cause of why you're unable to get pregnant. We're not here to cover up and put a Band-Aid over the wound. We want to find out why you're not able to get pregnant. What's the underlying reason why? So with that, our Dr. Tynes will do a complete assessment of you, and she will review blood work and really try to get down to the root of where does your deficiencies lie. And she will compare it and really analyze what's going on here in your medical history. Because the East versus West, when it comes to medicine, has two different views in how they approach fertility. So when you go to a doctor in the West, they're looking at, okay, you can't conceive. Okay, well, let's start you on these hormones, and we'll do this, and we'll try to get as many eggs as we can through the IVF process, and we will fertilize them with the sperm, and we'll hope, that you get pregnant. Okay, you're not ovulating. Okay, we'll give you Clomid, or we'll give you whatever, and we'll hope that we can get that going. But there's a reason why your body is not doing what it's designed to do. So on our end, we take a different approach. There's some deficiencies there. If you are not ovulating as you should, there could be a lot of hormonal problems. Is it a diet thing? And so the goal with us is to identify the root cause and treat it naturally to be able to put your body back into alignment, balance it out so that it can do its job. And if you do nutrition, proper nutrition that is designed specifically for your problems to nourish your body, tone your body, then it can perform at optimal levels. But if your body is deficient, you can't expect it to perform at optimal levels to get you pregnant with a deficiency. It's going to be more taxing on the body. So our approach is a little different. Although we do work with Western medicine, our approach and how we look at the body is completely different. So we may tailor our herbs, and we'll use herbs, a lot of Chinese herbs or other supplements to really help to nourish the body. Even with our massage therapists, there may be blockages in the uterus, whether it's fibroids or scarring, endometriosis, whatever it is. And so the goal of the massage therapist is not just to give you a Swedish massage and make you feel good, but it's really to get down into breaking down the scarring and the blockages in the uterus that may be preventing the blood flow and circulation, because you need blood flow for the embryo to attach and implant. So if you're not getting good blood flow, or if you have blockages and fibroids and other things there that are causing that, it's going to be a little bit more difficult and challenging to conceive. So that is really how we help on that journey. And it's just working together as a team approach. Because when you have the assessment, the doctors will then identify, what other services you need based upon your situation. So it's never cookie cutter. Everything is individualized to your specific condition and treating that naturally. That, if you can prepare your body, let's say you're deficient and you bring your levels back up to a more normal level, then you have more optimal chance of conceiving, and sometimes naturally without the need for any type of a conventional, assisted reproductive technique like IVF.
That is some beautiful information. Like, just even thinking about blockages. I mean, being that, we all practice, we live in Western America, Western medicine world, where everything is pushed towards, there's a pill for that, there is a prescription for that. And just to hear that we can use our food to heal, we can use massage therapy, the touch, we've kind of forgotten about touch a lot in Western medicine.
Yeah.
And we forgot about circulation, which is important, because where's a place where there is no circulation, it's obviously not going to be well nourished, and it obviously will die. So those things are so great to hear, especially being one that has practiced in Western medicine. And I spoke to you earlier, and I said, you know what? I felt like this platform and these women are going to really absorb a lot of the tidbits and facts and everything that you're going to share, and even seek out your help, because a lot of us don't even realize that we are eating wrong, even though we're eating healthy.
Right.
I have coined the term curve health. We think we're, because we're on a plus size curvy girl platform, and of course there's women on here who aren't plus size, who aren't curvy, but still follow us. But even the food that we eat cause inflammation in our uterus.
That is so true.
So
and that's oftentimes yes, and that is oftentimes one of the big factors, the inflammation factor, because it's not like it's shown in your blood work and say, oh, you have inflammation here. And oftentimes you'll get the diagnosis of, they don't know why you can't conceive. Nothing comes up. You do all the blood work, you do all the tests, and they can't tell you why. So the undiagnosed, unexplained infertility, and then when you start digging deeper, and then you start looking at analyzing how you eat, what you eat, your stress level, the toxins exposure that we're already exposed to on a daily basis, but then it can be things as high stress, not sleeping well, not eating, drinking enough water, not having enough nutritional intake through supplements and vitamins. Vitamin D level could be low, your iron, zinc, a number of things that sometimes get overlooked, because, if you're going to mask it with a drug and then trick the body to perform, you're going to overlook a lot of things that really should be looked at, because you don't need to look at it. We're going to trick the body to give us what we want, but then you don't implant, you don't get pregnant. And that's a challenge. That's a hard, difficult thing to have to go through.
Yes, it is. And to even have a team where you have, yourself as a coach, and you're able to refer for therapy and counseling because of the anxieties that come with fertility treatment, or the anxieties that come with conceiving and having loss, or the anxieties that come with, I don't even know what I'm doing.
Right.
So just to have that team approach, that's so well appreciated. At least for me, I appreciate hearing all of this, you know. So you mentioned toxins. Question came to mind, like what is the process of finding out, hey, I have toxins, heavy metals in my body? How does that even work out? What are the steps that you all take for to find that out?
Well, we do blood testing, and we work closely with another center in Winter Park, and they run our labs for us. And so, if that is a concern that the doctor has, we will then send him to get that blood work done to identify, are there any type of toxins, heavy metal toxins in the body that's building up to cause problem with the fertility, because that does come into play. And so we will run that test if needed to identify that. We first try to start with just the baseline blood work, checking, your FSH levels, your LH, your estradiol, all of those things we want to check for. The female hormone panel is what we would initially run. Or if you've gone to a fertility doctor or fertility clinic already, you can bring that lab work with you, and our doctor will take a look at that and analyze that. And if there's any additional tests, like the heavy metal test, we will then send you to the lab to get those done as well.
So what are the heavy metals? Because I know a lot of the people are like, heavy metals. So you're trying to say is it in my food, or is it, what are the heavy metals, and how are some of them even, like, I mean, not necessarily attracted, but consumed or absorbed? Because I for one still, I mean, all I'm thinking in my mind is mercury, iron, iodine, but I'm sure there's more. Could you elaborate just a little bit on that?
Well, a lot of things that we're exposed to, whether it's in your home or things that you're using on your skin that is absorbing into your skin. So even if it's things like, let's say certain perfume, heavy scented type perfume lotions, or even like your air fresheners that you'll be breathing in. So, those are some of the things that you could even look at as being toxic. And then, there's other things that you consume, maybe with even food. And so those things start to build up, and then it can lead to reproductive health issues. So we always look to see, like, well, are there any things that are building up? Is that a factor where we would need to look at and test for to see, is that causing you problems with fertility?
Because I mean, I asked that question because honestly, throughout my entire journey through fertility, I have yet to be tested for any metals.
Yeah.
So ladies, this is the perfect opportunity to get into a practice and be supported on your journey and be looked at not only in the Western medicine way, but the Eastern medicine way, because we are, in a very toxic environment. We have different, like she said, different lotions. I can only imagine some of the lotions we use in perfumes have aluminum that can't be, or even our deodorant has aluminum and stuff that can't be too good, but we use them anyway. I'm not trying to tell you stop wearing your stuff or your makeup. I'm not trying to tell you that, but just to even know that level, because in Western medicine, I have yet to send, unless there's specific things that you cannot identify with certain, blood level or whatever. We don't always send to get your mercury level tested, iodine, aluminum. Like, it's just not something that is common, So to even hear you say that's enlightening.
Yeah. And then, some people would, complain of like, oh, I have tingling in my hands or feet, or they're feeling tired all the time. They're always drained, exhausted. Or they having like maybe irregularities in the heart rate. There's all like different symptoms, like they're always dehydrated, thirsty. It's like they can never get enough rest, or there's diarrhea or vomiting or different symptoms that they may be having, abdominal pain. But then they're always looked at for something else for those symptoms. And it could be as simple as things that are being consumed in the body or that they're exposed to that's triggering these things, but nobody looks at it that way. Like I said, the East and the West approaches the human body differently. And, the two working together is ideal. It's a great marriage if the two work together. because each looks at something differently, but both pieces need to come together so that puzzle can be complete. And it's so important to really look at everything in a holistic view, because if you look at the body holistically, you get a full picture of the body, not just segments of the body. And so that's why we ask for medical records from Western medical doctors, because we want that complete picture before saying, here's a treatment plan that we would put you on. And because we don't treat anyone without any medical records when it comes to fertility. You have to have some blood work done. We have to do an assessment. We will refuse treatment without knowing what it is we're looking at.
Right, correct. I once read somewhere about holistic medicine and how it seeks to address all the systems of the person's body to improve their health, to heal disease, and to maximize like their wellness state. And if we start really believing and understanding that, we understand that health is a holistic approach if we let it be, and it's not always like a physical component. It has to do with our mental health, our emotional, our social, our spiritual health. It all comes into play. So I love the definition of holistic health, because it's really just like the word, looking at the whole person. I feel like that's exactly what your practice does. Am I correct?
Yes, absolutely.
Perfect. Because again, we're inundated with so much information on Western medicine that is, I mean, our approaches are pretty direct. We are symptom focused.
Right.
Right. So we're treating symptoms.
Correct.
But whereas Eastern medicine is like, I'm going to focus on the holistic, the whole person.
Right. So we want to know why you're having the symptoms.
Right. The whys of it, not just like, oh, let's take care of it. Here's a pill, here's a prescription. Although there are places and times for that, sometimes we just need to address the whole person. Like you said, the marriage between the two causes, I mean, I can only imagine the results of that.
Right.
I mean, I'm appreciating our conversation, tonight because of that. Even in my practice when I'm at work, how to approach the whole person,
right.
And really not just say, oh, it's because of this, but let's take a look at the entire picture and fully assess what this person's actually complaining of and what they're actually coming out of, or trying to manage, right? So we talked about the toxins, you talked about acupuncture. Let's dig into that. I know I told you some things we were going to talk about, but I feel like I'm like interested in everything. I want to know something about everything. So the acupuncture, how does acupuncture come into play when we're talking about infertility?
Okay, so acupuncture is a very old, ancient Chinese traditional medicine that has been around for centuries. It's at least probably even older than 4,000 years old. So even before medicine, the ancient Chinese have been using traditional Chinese medicine to treat themselves for various ailments. And so what acupuncture does is they have meridians that run through the body that connects with various organs. And so through these various meridians, there's blockages that can happen, stagnation. And so what they look at is trying to identify, where is that stagnation? Where is the energy not able to flow? And at that point, that correlates with the organs, and also they use that then to treat those points that correlate to whatever it is, that issue that you're having. And so by removing the energy flow, now you're able to actually heal the body that way. And so what they do is they take the needles, it's these long needles, they're very thin. People think that they're like a blood drawn needle. It's not, nothing at all. The needle is as thin as the hair of a dog. So it's very, very fine needle. And they insert into the points along the body on the meridian. And that is where the treatment begins. And the acupuncture needles are used to improve circulation, improve any blockages that may be there, break down that. It's used to treat various conditions that may be in the body. bring balance and restore harmony to the body. And also, in addition to the acupuncture, the use of the Chinese herbs. The herbs are customized and formulated for your specific condition. And in addition to the acupuncture treatments, the herbs help to tonify the body, or depending on what they're doing, whether they're trying to cleanse the body. Oftentimes when patients come to us, our doctor may start them off with like a detoxing herb to get out all of whatever it is you've been using, whether it's fertility drugs or just the foods and the toxins from the body, before even getting into your fertility herbs. Because the herbs work best in a more alkaline, neutral body. If the body is too acidic and too much going on, the herbs literally have to fight their way through to work. And then it takes longer before you see the results. So what she would do is cleanse first and then start to use the herbs. Because at that point now you're on a treatment protocol, which really helps the herbs to work. So the two go hand in hand. The acupuncture and the herbs often work together hand in hand.
Now, I'm so interested in this because I have never had acupuncture done, and I am one of those people who think like, I'm not gonna have anybody poking me with all these needles. Like, what is that? But just to even hear about the energy blockage that can happen from various nerve ending, reasons, and maybe even traumas that we didn't even identify. So I felt like, man, that is a great option, a great resource for women who felt like they've tried everything else, to seek that, especially someone who is, not just your acupuncture for relaxation. This is someone who is,
right,
well trained in fertility and reproductive functional, treatments. So, and the herbs, and the herbs.
And the herbs.
That makes a lot of sense. Lots of sense to come and clean the slate after I've tried everything else, right? I've been on all these drugs, cleaning the slate and getting a detox. We detox, ladies, for everything else. We detox for diets and all that kind of stuff. So why not for our fertility? I
right.
enjoy that. I enjoy hearing
that I myself do acupuncture regularly, just for just general maintenance. But during the fertility journey, because I had uterine fibroids, so I had to I treated myself with the herbs for that, and so they shrunk. But one of mine detached, but because of the size, I couldn't pass it. So I had to have surgery to remove it because it was just lodged. But the others actually shrunk, which was really good because of the use of the herbs. But the scar tissue that I got from after the surgery, I had to use the acupuncture to help break that down. And because the scar tissue can also cause problems with you trying to conceive, because you want your endometrial lining to be without any issues, and depending on where they cut, how they cut, what's cut out of your uterus or where else, it can leave scarring after surgery. So we use the acupuncture to break that down, and I literally could feel where it used to be hard and then it became soft. So the scarring underneath the surgery, the scar tissue underneath the surgery scar, it really got a lot less and less after each treatment and use of the herbs. So
is this something you would also recommend for women who have conceived, gave birth, and may have had to have C-section? Being one that I've had one, so would it be something that you would recommend to be done?
Yes, absolutely. If you, because some people end up afterwards having discomfort with the scarring, and yes, you can use acupuncture and also the herbs to assist with that, to help break down that scarring. Because some people keloid, and that keloid, especially with African American women, keloid a lot easier, and you have that scar tissue that's there, and sometimes you may have discomfort with that. And so you can utilize the acupuncture and herbs to help break that down. And also another thing that's good for that is your castor oil packs. with the massage therapy, because castor oil is very good for help to breaking down scar tissue. And so that is something that we do as well at the center.
So after, for example, after a woman has had a C-section, would you recommend that uterine massage that you were talking about, bringing the blood flow back too? Would that be something that you would recommend?
You can do it after a C-section. I mean, of course, after you're healed, well healed. You know, you can do that if you decide, let's say, you know, you want to have more children, or, you know, that is something that you can utilize. We use it a lot more for those who are trying to conceive and helping them with bringing the blood flow to the uterus, especially for women who are going through, whether you're trying naturally or going through the IVF journey. Because like I said, the more blood flow, it helps with the implantation. So we just want to be able to help with the implantation of a good quality embryo into the uterus. And so circulation is so important for that, because you know you need an increase of blood circulation, blood flow into the uterus to help nourish the embryo and help it to implant. And of course, a good quality egg is always essential. And you know, that's something that we also assist with, is improving egg quality. Because if the egg quality is not good, then also, you know, you may have an egg that actually fertilizes with the sperm, but if it doesn't implant because it's a not good quality egg, then of course, that's one less chance of getting pregnant. So egg quality is also important, and try to make sure you get that egg quality improved.
Yeah, so those women typically might suffer a early miscarriage, spontaneous, what we call spontaneous abortions that may happen, and we don't know why. Like that'll be the question that, you know, they'll come to the doctor and say, well, why did this happen? And we don't know why. The body decided that it wasn't healthy, a sustainable, you know, pregnancy. Hard to hear, but this happens more often than not.
Yeah.
Unfortunately. So we're hearing all of these, you know, treatment modalities, ladies. So drop your questions and your comments for Koreen and her team, and I'm sure she'll get back to you. I'm sure she'll comment and give you all her tidbits, and you schedule an appointment to go see her. But my next question is, how do you support the women who has suffered? We just talked about miscarriage because of the, you know, the egg implantation and the healthy quality egg. So how do you support those women who have suffered miscarriages?
Well, you know, one of the things we offer also is support groups. And so we do have those. And you know, we're going to start back up next year with our support groups. And we also have on our Facebook page a free support group area for women of all fertility issues, where they can connect with each other. And also I'm there, and then we do our weekly videos and sharing information with you. But when it comes to coming into the office for treatments, we also help women through the acupuncture and Chinese herbs, because we want to help them with building or improving egg quality. We can't increase the number of eggs that you were born with. You know, you're born with X amount, and that's all you're gonna have. But what we try to do is improve the quality of what you have left. And so that's important, you know, whether it's through the acupuncture, Chinese herbs, diet change, and it is very structured. It is something that you're gonna have to be disciplined to follow. Can it be done? Yes. I've seen women, and including myself, go from nothing happening to something happening, all through acupuncture, nutrition, sticking to it. It's gonna be challenging, but it can be done. But I've watched, even for myself, go from, like I said, first round of IVF, nothing happening. Second round, actually having viable eggs that fertilized, frozen, good quality. So it's a matter of shifting and making changes, and you have to be mentally prepared to do that. It's not going to be easy, but it can be done.
And that's why you provide that entire, the holistic approach, but the whole team approach, where, like you said, you have to be mentally ready. As you're coaching the woman, you're also making sure that she's mentally stable to sustain and carry the not necessarily the stressors of the treatment process, but the treatment process, because
Yes.
it is a process. And some of us can give up or not get the exact results that we want to hear off, off bat, like from initial assessment. But, understanding like we don't give up on the process as we
No.
grow. Okay.
Yeah.
I love that. I love that. Now we've talked a lot about women. I want to know, do you all treat men and their fertility issues? And how do you
Absolutely.
support them?
Yes. Men are a very unique niche. It's always our fault. It's us. We're the one with the problems. And that is not true. And, I always tell the women when they come in, because sometimes their husbands or, whatever, their significant other would come with them and they'll say, it's for her. Well, how do we know that? So it's not always the woman. There are men with low sperm, no sperm, abnormal sperm. And yes, we do treat them as well. And so acupuncture and herbs are good for that. And men are always afraid about acupuncture because they think we're going to target that area. That is not true. So, I always try to tell them, no, that's not true. We don't target that area. There are other points that the acupuncturist targets. And there's other things that they can do as well. And yes, the herbs are great for increasing sperm count, motility. We want them to have strong, healthy, viable sperm. And so, yes, we treat men. It takes two. And so it's not always a female factor. There's also a male factor that comes into play.
And that's very important to talk about, because the light is always shone on the woman. We're always talking about us. We're always talking about endometriosis, PCOS, whatever it may be, hormonal imbalances. But we really and rarely talk about the man.
Absolutely. And we can send them to get sperm testing to see what their numbers look like. And like I say, it's not always a female factor. And there's nothing to be ashamed of. It's a hard enough thing to go through already without putting just, the weight on one partner and saying, you go get checked. It's probably you because it's not me. I'm the man. Support each other on that journey and both say, you know what, let me check, make sure I'm not contributing to this. And also the women do the same. Because that really helps along the journey, whereas all the weight is not carried by the woman, making her feel as though she is the one with the problem. So yes, we support men on this journey as well. We support them even coming to support groups with their significant other, because that helps. It helps in having someone there to walk with you on this journey, especially if they're part of this process.
Correct. And I was going to ask about the support group, so I'm happy to hear that you do have that, resource available for them to attend, because again, a lot of times men are forgotten on this entire journey. And it's not that we want to forget them. It's just like women are like, we're the incubator. Like, why is it not sticking? Why is it not happening? But you made a great point, because their sperms may be unhealthy.
Mm-hmm.
And unlike us women who are born with all of our eggs, however many we're going to have in our lifetime, men create sperm all the time.
Correct.
So even educating them.
Yeah, so true. And it's a lot easier to treat them also than it is for the woman. So, it's not that difficult, to help the man to improve sperm, count. So it's like, don't be ashamed. If you are the person with the infertility factor, just, don't be ashamed to say, let me get checked and see if there's something that I have that's contributing to why we're not getting pregnant.
That's great, great, great point there. Thank you for that. Thank you. So again, being on we're on a plus size curvy woman platform. I want to know how comfortable you are in caring for the plus size curvy woman and helping her continue to gain hope of getting pregnant.
Well, we give that to any woman. So it's not a focus on your size per se. We give that hope to any woman, and we're here to help all women. If you have the drive, if you say, I want this child, and I just want to be supported in this process, as long as you say that you want this and this is your goal, we are standing by you. So no matter what the size is, we have women of all sizes, all colors, nationalities that have come. We've had women as far as Turkey that has come to us and gotten pregnant. So it's not, we don't look at the size. What we do with all of our women is educate them on healthy nutrition, exercise. This is all women. And also making lifestyle changes that are conducive to fertility. And that goes for all women. And so, we are here to support everyone.
I like hearing that. And this is the reason why. Because I'm a plus size curvy woman, because of the field that I practice in, it's really become a passion of mine to make sure that people are comfortable. Believe it or not, there's so many practitioners that will see a plus size curvy woman and cut them off.
Wow.
Cut hope. And the treatment modalities are even different because the first thing they're going to say is you need to lose weight.
Wow.
And I actually, changed my entire care team because of that. I have lost weight, and I did it for me and for my well-being in my house. But my first thing, like the first thing, you didn't look at charts. The first thing you said, well, you're not going to get pregnant because you are over a certain BMI. And I'm thinking to myself, like, can I get some labs? Can we have a conversation? Like, so to even hear you say you take care of every woman, no matter the size, the color of our skin, the ethnicity or country that we were born or live, I appreciate that. As a provider, to even hear that, I love the inclusivity of it.
I mean, we're women. We should all be treated. If you're coming, the commonality between all of us in this field is fertility. The goal is fertility. And, as women, we also have that commonality. We're women. And so the thing with my center is we're all women working together to help women. So we're a center filled of women. And so we know our bodies, we understand it, and we all come in different colors, shapes, sizes. So like I said, our goal is to give hope to women. That's why we are Hope Fertility Support and Wellness Center. And that is our goal. We're not here to, make anyone feel bad. That's not what we're here for. We're here to educate, and that's all women. And we are here to support you and empower you and help you on your journey. So we don't look at, ways to make people feel bad because, women after they hit age 35, they tell them, you're of older age, and so you may not get pregnant. And I'm like, how many women I know over the age of 35, women in their 40s that are conceiving for the first time? You mean to tell me that after you hit 35, like the end of the world is coming and you can't conceive? It's like, give me a break. I know a lot of women who are conceiving in their 40s and having healthy babies. I know women in their 20s that have conceived and had children with different mental health issues or disabilities. And they say, after a certain age, then, your chances of having a child with this and that. And I'm thinking, okay, whatever you say. I'm a person of faith, and I'm a person that will stand on that. And I'm not going to allow someone to tell me just because your textbook or science says this, that this is the only option and this is the way it's going to be for me. So all women out there, if you're looking for some hope and you are on this fertility journey and you want a team behind you of women who are here to support you, we're here.
Listen, I just want to give Like, I want to just go ahead and clap now. Like, I don't know if everybody else is clapping, but I'm clapping because I'm overjoyed. And the reason why is because to know that you have somebody who's going to be in your corner that doesn't have a preconceived notion or doesn't have a cookie cutter plan to get you to the end goal of conceiving and beating infertility, because I like to use that word, let's beat it, and infertility being resolved, it could be resolved in many ways. It could be through, adoption or whatever, adoption, IVF, IUI, it doesn't matter, or even just conceiving on your own. I just feel like when you have a cheerleader, you have a team of people just cheering you on, that hope is not lost.
Right.
It puts a huge smile on my face. Now, ladies, I really wish I knew about Koreen and her crew and her team over there in Winter Park that's doing such amazing things like this, that is standing up for women and standing up for our uteruses, standing up for our men, and really working through this fertility journey and customizing a plan for you in combination with your providers.
Right.
She's not telling you our way or the highway. She's like, no, we work together.
Absolutely.
We work together.
Absolutely. And the thing is, we will also tell you if we can't do anything for you. Because one thing I know of, even if you're trying to go through the IVF route, it's expensive. And so I don't want you to waste your money and you come to us and we're just taking your money knowing that we can't do anything for you. That will never happen. Because I ensure that every assessment that comes through, we are able to help treat. And if it's something that requires an MD, we're going to refer you to an MD if you don't have one. And we will tell you, we can't handle that here. You need to see your fertility specialist and work with them. So we will tell you exactly how far we can go, and we will give you the reality of your situation so that you can make an informed decision on what you want to do next. But if we can help you, we will be there with you until the end.
See, now that I appreciate that. That's talking about scope of practice, you guys, because there are people who practice outside of their scope of practice, and that is dangerous. Yes. So to hear Koreen even bring that up, that if they have met their scope of practice, they've met all of their goals, they have, crossed all their T's and dotted all their I's, and they still, during the journey, no matter how long, because it could be for a really long time or a short period of time, correct, Koreen?
Right.
Yeah, so no matter how long, and we're not succeeding, it's not that they're losing hope in you, conceiving, but there could be some other factors that that your medical professional probably have already spoken to you about, and so that you're seeking alternative medicine for that. But she's stopping. She's like, hey, I'm not going to just sit here and tell you this is going to happen when structurally there might be a reason why you can't, or it cannot happen. There's so many various reasons that every woman is different. And I love the fact that she said this is a customizable process, because what would work for me may not work for you, right? So, I mean, I don't know. Y'all drop the comments. Y'all tell me what you are learning, how you're growing tonight with this information. And for some of us, we've never heard this. And again, I have just been, previewed to this, and I felt like, where was this?
Yeah.
When I was going through.
I felt the same way before when I was going through it. Why wasn't there a one-stop support shop for those with fertility? And there is none. We are the only ones here in Central Florida that offers this service. And because our focus is fertility, so we're that one-stop holistic fertility shop here in Winter Park. And the thing is, we work with people all over the world. You don't have to be here. So we can actually do a lot of virtual consultations with the doctor, just like we're talking here. She can do that. You send in your medical records and your assessments that we send you. You complete it, send us back, we review everything, and she's face-to-face with you and going over that, and then telling you what a treatment plan is going to look like. You'll get a copy of that in your email, and then you can decide from there, do you want to move forward? Even some of your treatments can be done at home. You don't have to be here in person in the office, because we can ship the herbs to you. We can ship some of the other supplements and things that we're going to tell you to do this at home. Ear seeds. You can do your ear seeds at home, which help to like mimic like an acupuncture session. You're not physically in the office, but you're away. You can do your ear seeds. And so we have other ways of working with people who are not local. So don't feel as though, well, I'm not in the area, so I can't, you don't have to be here.
And two ladies, if you're across the country somewhere and you're like, hey, winter's coming, I'm tired of this snow. I'm taking a flight down to Florida where it doesn't snow and be on vacation and go to Disney. Oh, and go see, Koreen and her team. Feel free to do that. Like, hey, make it like a family thing. She's a team of individuals. We do things as families. Fertility, is a family adventure. We're seeking to grow a family. So I feel like whatever you have to do, if you have to come down here, come on. But look at that convenience that they have, to do a virtual visit and ship things. I'm just so impressed. I really am, and honestly am so happy that you were able to join us tonight and just to inform us of our options. Who doesn't like options?
I know.
Women love options.
Yes.
I love going to to the store and having 3, 4, 5 things to pick from. Maybe the choice a little harder, but it's worth it. It's worth it. So a couple more things before we close tonight. I just want to know, what are some common myths about the holistic fertility health approach that you would like to debunk? You would like to say, hey, that's not true. Here's the truth.
Well, first of all, you may be told by your Western doctor, it's a bunch of nonsense. This stuff does not work. And that is the only option is IVF. And so I want you to really consider holistic medicine. This is something that's been around for thousands of years. This is not anything new. Chinese have been using this and for thousands, 4,000 plus years. Medicine is a lot newer. Yes, they have great science behind it. But think about your grandmother when you were sick and your grandmother fixed up some concoction and tell you to take this and it made you feel better. Who studied that? But it worked. So I use that analogy when I hear stuff like, that's a bunch of nonsense, it doesn't work. It's really in what you believe. Okay, so this stuff does work, because if it wasn't, why are so many women getting pregnant using acupuncture in support with IVF, or acupuncture in support with natural conception? So it is working. It's a more natural approach. It's not going to happen overnight, because anything natural, you have to remember, your body has to take time to clear out all that it's doing, and then it has to work naturally to do its job in conception. So while we may not be able to help you get to the finish line in 30, 60 days by helping your body to mimic something that it's really not capable of doing at that moment, but it's fighting to do, we can heal your body and help you to get to that point. So holistic medicine, I find to be very helpful. It is not anything that is going against Western medicine. It supports, and that's another thing. You may hear, it's a bunch of nonsense, it doesn't work, it's crap, there's no science behind it. And while there are studies, you have to remember it's holistic. So a lot of holistic medicine is not studied the way Western medicine is. We don't have a pharmaceutical giant, behind holistic studying acupuncture or Chinese herbs the way many of your pharmaceutical drugs or even the techniques that are used by Western medicine is studied. The money is not backed behind it to study it, but it is effective. Women are saying it works. Another thing is a doctor of Oriental medicine, and then there's the medical doctor. Two different types of doctors. A doctor of Oriental medicine is an actual doctor. They're not a medical doctor. So there is a difference there in the two. However, they have gone to school. They have studied, they've sit for the boards, they have passed the boards just like a doctor would. They've gone to school, they've studied the body, they've sit for their boards. They are licensed. Your doctor of Oriental medicines are licensed practitioners. They have actually taken the board exams and passed it. But their focus is different than your actual Western medicine doctor in how they approach the body. So they are a real profession. And so they do have, they are called doctors of Oriental medicine. So they are true in what they're doing. And in the state of Florida, we are licensed. So it's a regulated profession. Some states it's not, but here we are regulated. So those are some of the myths that I just want people to know, that these things are not, holistic is not a bunch of crock. It actually works. It helps to encourage the body to be in a more normal, balanced state without the use of a lot of the pharmaceutical drugs that go into play to mask certain symptoms, but we actually treat the underlying root cause to help your body to perform at its best.
I love the explanation. Thank you for letting us know about the Oriental doctors. You know, that's what they study. Now, with that, is a naturopath about the same thing too? I know we like the NDs, the naturopath and the Oriental. Are they about the same type of certification, or?
No, they're separate. Two different sets of study. Two different types of doctors, but it's along the similar approach. But the doctor of Oriental medicine more along the traditional Chinese medicine path.
Okay, makes a lot of sense. Ladies, are you guys writing and taking notes? Are you listening? There are options out there. There's support out there for us on this journey. Even if you have conceived and you're thinking about conceiving again, getting that coach behind you, getting the food, learning how to eat, eat fertile. That's the word that kept coming to my mind. You're eating fertile, move fertile, detoxing our bodies, creating that alkaline environment. And I mean, even in the medical society, we use a lot of that, talking about alkaline versus acidic. When something's acidic, it burns, it hurts, but that more alkaline, a lot of bacteria and cancers and all that kind of stuff cannot exist or coexist in that kind of an environment. So imagine about the environment that you're creating for that fetus, that baby, that egg, all of it, the embryo. So this is so exciting and so great to hear you talk about this, Koreen. Thank you so much. Thank you for being with us tonight. But before we even close, I want to know, how can someone contact you for more information? How can they come see you guys? How can they join a team? Like, how? I know they're asking.
Well, we are located in Winter Park, 1400 South Orlando Avenue in Winter Park. You can reach us via our website. That's www.hope, H-O-P-E, FSC, Frank, Susie, Charlie, so hopefsc.org. Or you can give us a call at 321-203-2213.
Write it down. It's also going to be in our description on our live, so you'll be able to go ahead and get all of her information, because I am going to include it on there. And I know that women are going to be contacting you, because even if it's just, ladies, just to get detox, even if you want to just learn some more, maybe you need somebody in your corner. You've been doing this for a long time. And I know I've shared with you, ladies, how I did this for a while without even telling family or friends. And the discouragement that came with that, just to know that there's a support team that can point me in the right direction, kind of help me see things that I didn't see or understand. And kind of maybe even give me a hug when I need it, because my goodness, we need it on this journey. So go ahead and contact them, get connected, get scheduled, get in and see the team at Hope Fertility Support and Wellness Center. Koreen, thank you so much for joining me tonight.
Thank you so much for having me.
Thank you for the insight. It's a journey.
Yes,
and we have to do it together. So I'm honored to be able to share what I've been exposed to to these beautiful ladies out there and families and husbands and all that. Everybody, it's a family project. So I appreciate it. But at the end of every segment, I always close with a verse. And tonight it's going to be the third John, chapter 1, verse 2. It says, "Dear friend, I pray that you may enjoy good health and that all may go well with you, even as your soul is getting along well." Y'all, we're going to be well. We're going to be healthy. We're going to see those babies and those positive tests. Go ahead and share this video. It's going to help somebody. And somebody may be looking for this exact information, for this exact resource. And because you shared it, they're able to see their dream come to fruition. Thank you for joining us. Y'all have a wonderful night, and I'll see you in the next episode. Bye.